safety for the Pathfinder clubs. We will have Danita Mullins presenting this. And at this time, I'm going to stop my screen share and turn it over to her.
All right, thank you, Beth. I'm going to share my screen here just a second here. Get that on full screen there. Okay, there we go. All right, so when Roger asked me to speak on this a few weeks ago, I wasn't exactly sure where we were going with this, but he did give me a lot of really good resources, and it's really stuff that we have been living in for really the last 6 months. One of the things about September 11th that we did realize yesterday was that it was exactly 6 months after the state of Arkansas declared the state of emergency. So a lot has happened in 6 months, and I know most of us did not expect it to keep going this long. So we're going to go over some different things that we need to take in consideration for specifically COVID-19. So just a couple things, just talk about COVID-19 information, some precautions to take, some club safety for returning back to face-to-face, things like that that we can keep in mind. In general, safety precautions, and then we'll open it up to Q&A after this. So just a little bit about myself. So I've been a registered nurse in emergency services for over 21 years. Worked anywhere from emergency, I was a trauma program manager at one point, and had been working in disaster management for different types of disasters in Arkansas for the last 20 years or so. Also have a Master of Science in Nursing, and I'm the current Director of Emergency Services at Washington Regional in Fayetteville. I've been the Director of the Springdale Lions Pathfinder Club for the last couple years, and I do have 2 kids. One of them is still in Pathfinders, the other one just went off to college, so it does keep me busy. So just a couple things. So if you all were at Oshkosh last year, and we had to deal with the COVID-19 pandemic in the middle of 55,000 people. That would have been like my worst nightmare as a Pathfinder leader. Very, very challenging, and trying to keep masks with that, hand washing, social distancing. There's absolutely no way we could have social distanced at Oshkosh. That would have been just absolutely crazy. So a lot has changed in the last year, coming from that type of setting to basically doing Zoom meetings. So in our club in Springdale, we've been doing Zoom meetings starting in March. This is an example of a Zoom meeting. We did the physical fitness honor, and so we had to have them show basically them all doing the plank and different things like that. But big differences just over the past year. So different things that we want to be aware of if you're thinking about possibly returning back to face-to-face in the current pandemic. In our club, this last week was actually the first week that we actually did one. We did that outside, and we had an outside event. Know your community situation and your surroundings. So the thing with this particular outbreak is it varies on locations. You will have an outbreak in one community one week, and it'll kind of die down in that area, and then it'll shift to another area. And so it's not always, you know, a huge outbreak in the same place all the time. So it's really, really important that you know what's going on. So reach out to, you know, friends in the medical community, disaster management community, know what your current risks are, know what your websites to use as resources. If you have a current outbreak on the rise, if you have a local school system that had to shut down, sometimes we had to do this even with flu outbreaks. If you have a specific outbreak with that, you may want to hold off bringing back in-person meetings depending on your area. When in doubt with anything with Pathfinders, you need to err on the side of caution and make sure that you're always keeping your Pathfinders safe and keeping yourselves safe. So as leaders, we want to make sure that we're continuing to monitor and adjust, follow all guidelines as set forth by the CDC, local government, and the SDA conference. There are certain rules that we have to make sure that we are complying with, and we're governed by a lot of different agencies. Oh, hold on, my slide's not working here. Sorry. So just a couple things about our current status in the state of Arkansas. So statewide, 67,911 confirmed COVID-19 cases. This is as of yesterday's data. What I tend to look at is the active cases, a little over 5,700. That is how many in the state of Arkansas right now that currently have the actual disease. So they could possibly be spreading and those type of things. So that's the population that I tend to look at. Total deaths in Arkansas, and where are the current outbreaks on this. According to the healthyarkansas.gov, this is a website that I check very frequently on there. It tells you where the current outbreaks are and where the areas that are the highest risk. Pulaski County, Washington County, Craighead, Benton, and Sebastian County. As of yesterday, those were where the highest increase of cases were. One of the interesting things about it, I do live in Washington County, and University of Arkansas is where majority of the outbreaks are. They have a separate dashboard that they report their increased cases. And just because they have this many cases doesn't mean it's necessarily reported to the state of Arkansas. If their home address is in Texas or their home address is somewhere else, those aren't necessarily reported to the University of Arkansas. So there's different things on there that make it a little bit difficult to determine where the actual outbreaks are. The only reason I am aware of a lot of these is because they do come into my emergency department, and we see the ages of people that are affected by that. But it's really important to really look at different sources to figure out, you know, what are the risks on that. We had a local school here just this past week. A lot of our church members where the kids were actually positive for COVID-19. We did not allow them back in our club until they're cleared and they're doing their quarantine on there. But they have so far been very, very compliant with that. And so hopefully that will continue to be the case. If you are returning, you need to make sure that you have it completely lined out with your parents, with your club members, things like that, that they know what the expectations are. If you have a handout, an email, we have an email group, and we tell them, hey, these are the rules on here. So make sure that you give them the expectations. Do not attend a Pathfinder function if you're diagnosed with COVID-19. If you have a COVID-19 symptoms, if you're sick with another illness, if you're running a fever, if you're not feeling well. If a Pathfinder had strep throat, if they had fever from flu, or if they had any other type of illness, I would not want them in our club either. So we need to make sure that we're keeping them safe. If you're exposed to someone with COVID-19 or someone's being tested for COVID-19, if you're exposed to someone who has the flu, is sick, running a fever, if you've traveled outside your normal routine, or if someone has traveled to or outside their normal routine in the last 14 days. So you need to make sure you're, clarifying on that. We have several Pathfinders in our club that come over to our club from Oklahoma. That's in their normal routine. And just need to make sure that you clarify that. Make sure we're quarantined Pathfinders, tell them for 14 days as needed, as instructed by a doctor. And just make sure that we're keeping everyone safe by erring on the side of caution in this manner. If they don't know, they don't have the results back, and things like that. We've had a lot of issues with people that are tested. They don't know their results back, but they think they're perfectly fine, and they continue to go out in the community. And so just making sure that we, as leaders, that we're keeping safe and telling people to stay home as precautions on there. This is a sign. I actually taught the biosafety honor a couple weeks ago, and these are just common symptoms of COVID-19. Most of us know this. This has been in the news for a very long time. Common symptoms: fever, dry cough, tired, loss of taste and smell. Loss of taste and smell has become the hallmark really signs and symptoms if somebody usually has COVID-19. Serious symptoms that generally end them up in the hospitals when they have severe difficulty breathing, shortness of breath, chest pain, loss of speech, movement. It can affect their diaphragm. You can develop really, really difficult breathing issues. On average, it takes 5 to 6 days for someone who's infected with the virus to show symptoms, but it can take up to 14 days. So they can be at risk for quite a while. Prevention, biggest thing is make sure that you stay healthy. People with a lot of comorbidities and have other issues such as diabetes, respiratory problems, things like that tend to be at higher risk, or if you have decreased immune system. Socially distancing, wear a mask when you're around others that are not in your family, and washing your hands. Washing your hands is something that is not emphasized as much as wearing a mask, but it's extremely important, and it's one of the easiest things that you can do to help decrease spread of infection. So social distancing, so during official Pathfinder functions, if you're meeting in person, you may not be within 6 feet of someone who is not in your family unit. This can be really difficult. We had our first open meeting this week. We explained all of these rules before. The first thing these two girls did is they came up and gave each other a hug. So they were wearing masks, but we're like, no, we can't do this. We got to make sure we're social distancing. So it can be very challenging when you get this age of kids because they're so excited to see their friends that they haven't seen in a while. So just to make sure that we have people that are enforcing those rules. This even applies if you've spent time with another club member outside of Pathfinder time. We need to make sure that we are being socially responsible, because if something ever came back and they're like, oh, we had this big outbreak, it's because they went to a Pathfinder function and they all got COVID-19. So we need to make sure that we are being responsible. Make sure they're refraining from touching of any kind, and try to set up activities that encourage social distancing. So what we had done, and I may have gone over this in a couple more slides, is we made sure at the beginning, we actually put the chairs a little bit more than 6 feet apart, because we know that they will tend to scoot them together. So we made them a little bit larger, and we made sure that they were set up in their family units and things like that. Luckily, we had 3 or 4 families, so they could do that pretty well. Masks, so masks need to be required during any indoor activities or outdoor activities where social distancing cannot be maintained. If a club member is struggling to maintain the 6 feet of social distances, we need to make sure that we're providing them with a mask. The other thing that we did is we went over with our Pathfinders how to properly wear a mask. If any of you goes to Walmart or anything like that, there's a lot of people in our community that do not know how to properly wear a mask. So the mask needs to make sure it's completely covering your nose and your mouth. If it's not covering your nose, it's not doing any good. So making sure that you explain that to the kids so they know how to do that. Also encouraging not to touch their faces, which can be really difficult when you're wearing a mask and they're not used to wearing a mask a lot. So make sure that you have hand sanitizer readily available. Meetings, so our plan is to have our Pathfinder functions outdoors. Outdoors allows a lot better air control, and it's just healthier to be outdoors, and it's a lot easier, and it's easier to social distance. So in the event of inclement weather, so your leadership just should assess risks, circumstances to determine if the event will be canceled or moved indoors if you have a large enough space and possibly shortened. We're lucky at our church, we have a large gym, so we would be able to do that, but not all places can do that safely. So you just need to assess your risk before you do that. If you have moved the event indoors, just make sure you're finding the largest space possible to do that. Check-in procedures. So a lot of this will vary on how many adult volunteers that you have. So make sure you keep all extra family members, non-Pathfinders out of Pathfinder meetings. This helps it so that you can control the amount of people that for contact tracing and things like that. Suggestions, so you can have a Pathfinders remain in the car until it's released by a safety officer. Have the safety officer come to the car asking screening questions, wearing a vest, taking your child's temperature. So what we have, we actually bought one of those non-contact thermometers, and it's actually really not that expensive. It was like $45 on Amazon, and it works good as long as you have trained personnel that know how to use the thermometer appropriately. Your child cannot exit the car until they're cleared by that. We really want to make sure that they're not just running out there and then having the issues of everyone hugging each other and not social distancing. Offer hand sanitizer, make sure they have materials. We don't want them to be sharing supplies and those type of things. We want to make sure that we're keeping everything to each individual Pathfinder as much as possible. If you don't have a safety officer, make sure that they're either texting a director or Pathfinder leadership. Let them know that they've arrived so that we're doing everything in a safe manner. Supplies, like I said, no supplies will be shared. Each club member will be issued a supply pack of things to use depending on what you're doing for that day. Have them bring the pack to the meeting. No new supplies will be distributed and taken back. What we had did this last week, one of our first in-person ones, we did the Ultimate Disc Honor. And we had an organization that donated a whole bunch of discs to us. So we were able to give one to each Pathfinder. What we did, because we're like, well, they have to be able to, catch it when they're being thrown from another person. So we made sure that every Pathfinder used hand sanitizer before they threw it back and forth. And if there was any possibility where they're touching their mouth or anything like that, they're supposed to use hand sanitizer again. So as much as we could possibly do it, sometimes it's a little bit difficult, but we did make sure that there was hand sanitizer, so if they're touching it, but they were able to stay, actually they were like about 20 feet away or so outside, so they had a lot of fun with that. Each club member also can bring their own chair to the meeting. What we actually did as well is we brought the metal chairs out because we can wipe those down really well. And they were set up and we can wipe them back down and put them out there, because we did have some Pathfinders that did forget their chairs, and it just made it easier to do that. But there are different options you can use. Just make sure you keep safety in mind on that. Food, so no food or drinks will be served or provided. We want to make sure that they are not doing that because that is their opportunity, especially if you're indoors, to bring their masks down, so we don't want to be doing that. Instruct Pathfinders not to bring their own food unless it crosses a mealtime or you specifically instructed them to do something. So if you're going, say, on a hike or something and they need to like pack something in their backpack or something like that, I mean, there would be exceptions to that. Water fountains should not be used. Most facilities don't even have those working anymore. I know we have like a trash bag over ours at the church. And they can bring their own water bottle, being that it's clearly marked. We had a problem with they were bringing the plastic water bottles, and they were just like the Great Value ones or whatever you buy at Walmart. But then nobody was marking them, so you couldn't tell whose water bottle it was. And so we ended up just throwing a bunch away. I'm like, I have no idea whose this really is, and I don't want someone to actually cross-contaminate. So we're encouraging them, if you're bringing your water bottle, to bring like a unique one or very, very clearly have their name on that. So make it a lot safer on there. Restrooms, just encourage participants to use the restroom before they come to a Pathfinder event. Most restrooms at outdoor venues are closed to public use. Church facilities, they can use it if they really have an emergency, but we have to make sure that we sanitize and clean the restroom after that. So if you are having to open it up just for them to go to the bathroom, make sure you have a staff member go in there, or better yet, have the Pathfinder sanitize it, give them the supplies and have them do that. But that is one of the requirements on that. Sanitizing, so we went over specifically how to sanitize their hands, because hand sanitizing is not just putting a little thing in your hand and wiping it down for 2 seconds and being done. You need to actually make sure that they understand how to properly hand sanitize. And this is another one that we went over in the Biosafety Honor, is going over making sure they're covering each part of their hands and doing it for the proper length of time, which actually takes more than 3 seconds. So kind of going over that and making sure that we're providing sanitizing sprays and wipes at all Pathfinder function. One of the things that came up that I had not heard before is we do have some Pathfinders that their parents were very concerned on the safety of hand sanitizer, and I hadn't heard that before. As they said, there was different preservatives and things like that. And so if you have Pathfinders that have different allergies and things like that, you just need to make sure that you get with the parents, and if they have an alternative they want to use, they're going to need to have an alternative, because we do need to make sure that they're washing their hands. But that's something that came up this last week that I had not thought of before. So just make sure that we have a plan for that. Transportation. At this point, we're not doing any events where we're going to like a large camporee or anything like that. So if we're doing any sort of scheduled event in this area, they really need to be going in their own parent's vehicle. If there happens to come up a case where transportation is absolutely needed, where different family units would be together in the same vehicle, masks must be worn in the vehicle. Parents of both families would need to give permission in writing to know that that's a potential risk on that. So just be careful with that. Visitors, I've already gone over this. Just limit visitors, non-staff, such as parents, spouses, siblings. Really helps to comply with social distancing requirements when you have less people there. And if you do have a potential outbreak, it does help limit potential exposures and contact tracing. If you have exceptions dealt with in a case-to-case basis, like this past week, my husband was there because he was helping teach an honor. So, I mean, there are certain things that there's reasons why other people can be there. Other safety concerns. So whenever a lot of these kids have been home for like 6 months. So it's really, really important to check the welfare of your Pathfinders, even when you're doing those Zoom meetings. I know Audra talked earlier about having sharing time, and sharing time is such a huge, huge part of not only just getting the kids engaged, but helping them, feel safe. If there's something concerning, ask them about them. Many of them have been sheltered for months in possibly unsafe situations. There's different economic, other conditions, and so they may have adult family members or relatives that might be staying with them that may make them a little bit more risk for possible abuse cases and things like that. So most of us that have been in leadership roles know our Pathfinders. So just really, really checking in with them, making sure they're okay, seeing if there's any differences on that. During COVID-19, signs and symptoms of abuse might be a little bit more difficult to assess. Sometimes they're more anxious, they're on edge, they are scared to go out, they're scared for different reasons on that. But just really getting to know and letting them open up about what's going on in their lives so that we can help prevent any type of concerns. Also make sure that we're making sure all leaders and volunteers complete the mandatory training and all background checks as well, even if you're doing online, because we now have access to a lot of these Pathfinders online. So make sure that any staff is doing those type of background checks. Just remember also, each of us as leaders, we're mandatory recorders. It's up to us to make sure that we're protecting our children. So if you have Pathfinders, if they have a change in behavior, and this is a very, very brief list, there's like a whole lot more on this, but aggression, hostility, where previously they were not, if they have a big reluctance to go home, appear like scared at all, possible physical or sexual abuse concerns, unexplained injuries, bruises, fractures, burns, depression and social withdrawal. This is something that's definitely on the increase. I know, at least in the state of Arkansas and in Northwest Arkansas, a huge increase in suicide attempts and depression between the ages of 12 and 16. Which are Pathfinder age. And so things like that are things that we can help out as leaders and make an impact in their lives. If they have any sort of poor hygiene, malnourished, if you're bringing these type of concerns up and the parents are always blaming the child, belittles, berates child, if you see that there's any possible injury or possible concern, we need to make sure that we keep a look on that and report those type of issues if we think that there's concerns for that. So these are just a couple resources on there. Advanced Risk Management does a really good job of updating these type of recommendations very frequently. This is a fluid process. This changes very, very frequently. In the first month of the pandemic, as emergency department director, I rewrote our policy about 30 times, and it's changed about 30 times since then. So with everything, it's fluid, it changes. There'll be probably a different recommendation tomorrow based on whatever else comes up there. Also the CDC, healthyarkansas.gov is the state of Arkansas. If you want to follow what the latest recommendations are, or what the latest statistics are, things like that. And then the Mayo Clinic also has a lot of great recommendations, specifically on abuse cases and things like that, things that we can do to help with that. So just in summary, and I'm probably going really quick because I talk really fast, so I'm sorry. So safety is always the highest priority, and we have to do all we can do to ensure our Pathfinders are safe. So when in doubt, make sure that we're erring on the side of caution. And I just realized I talked really fast, so I really apologize for that. So if you have any questions, this is my information right here. I tend to respond to text more than phone calls, because if someone calls me and I don't have their name on there, I usually think it's spam. So if you want to text me or email with any questions, just let me know.
We do have a few questions, it looks like.
Sure.
So the first one says, I have a parent, not staff, who is demanding that they be involved in attending my meetings. How do I explain to them that extra family and non-Pathfinders are not able to attend currently?
Well,
nothing like a hard one for the first one.
Yeah, it's like, I think that was one of the conflict resolution ones, don't you think? I would just explain these are the rules for participation, and this is put up, by the, and sometimes we can make some exceptions, like, hey, you can stand back here if it's like more than 12 feet away or something like that, or you can stay in your car. I don't know if I have a perfect solution if they're wanting to be right next to them.
Okay. Sounds good to me. Okay, the next one is, what kind of supplies would you put in their supply packs? And then there's a second question attached to that. Would you use Ziploc bags or buy bags?
So I think it depends on what you're planning to do. So if you know what your activities are for the next month or so, these will be the type of supplies that you're going to put in there. If you're going to need like markers, or if you're going to do the knot tying honor or something like that, you probably need to have individual, ropes that are already cut out according to those size and put in the bag. And I would probably do a Ziploc bag because it's easily wiped down and it's cheap. I wouldn't spend a great deal of money for those type of things.
Okay, and we have one final question. This is another hard one. I have a family who refuses to wear masks. How do I handle kids whose families do not make them wear masks anywhere else?
I would say that's the rules. I mean, that's the rules of it. I mean, we've had, this has been difficult. We've had a few, I know just in our church, that will come and they won't wear a mask. And we've had them like sit in a separate area where like the little kids area, so they're behind it. But honestly, it's required. So that's part of their participations on that.
And as conference director, I would reinforce that. That is pretty much a generalized, understood requirement conference-wide that masks be worn. And it would be something that would pretty much need to be standard and stuck to it.
Yeah, and I think if you're establishing any rules, there really should be very few exceptions on there, because you start making exceptions and then you start having more issues on there. So it needs to be very standard, set forth. I think what is a great idea is at the beginning, especially if you're getting ready to go back to in-person meetings, you have it in writing, you send the rules out to each of the parents, and you're like, this is the standard. If you want your child to show up, this is what we're going to comply by. And hopefully COVID will go away really soon and we don't have to do this much longer. So definitely praying for that. So I just think we just really need to do all we can to help this go away more. But it's been so challenging. I mean, these kids were so excited when we finally did an in-person meeting, and we basically threw Frisbees, but they were so excited. Even if we had to be out there in mask, even if we had to be 6 to 10 feet away or whatever we had to do, getting out in the open air really makes a difference. And I realize probably when we start seeing more flu cases and things like that, we might have to start going back to more Zoom meetings, but I would take advantage of as much as you can. So.
Looks like we have another question that just came through. It says, what if you have a child with respiratory problems? And I'm assuming that wearing a mask becomes problematic. They said, would you require them wearing a face shield? How would you handle that?
To be honest, I would not have them attend, because a face shield is really not going to do anything any good unless it's covering your face in your mask. That's just my opinion, but I don't know. Mr. Huff, do you have any other?
I would agree. If they're that debilitated, the risk for them being in a group is much, much higher. They are much higher risk of contracting, be it a common cold or COVID. It might be something that might need to arrange a video link for them to get in and observe what's going on in the meeting, but it would be probably to their advantage for them not to be involved in the group organization.
Yeah.
Okay, well, I think that is all the questions